Hi and welcome to Think Pharma YouTube channel. How and what to prepare for competitive exam preparation. We will be going to learn from this video, and let me introduce myself to you first. This is Tejaswi, working as assistant professor in Department of Pharmacognosy. And if we are preparing for competitive exam, we will plan according to weightage, right? In the pharma field, like there were many subjects, so different subjects have different weightage. We will categorize that weightage into different forms like major subjects and minor subjects. So from major subjects, you will be scoring many marks, like it will be having many subjects and important subjects. Like first it includes pharmaceutics as a major subject, pharmaceutical technology, physical pharmacy, biopharmaceutics, pharmaceutical jurisprudence, pharmaceutical engineering, cosmetic technology, hospital and dispensing pharmacy are the subjects which were included in the pharmaceutic subjects. And next the subject is pharmaceutical chemistry. It includes organic chemistry, inorganic chemistry, physical chemistry, medicinal chemistry, and pharmaceutical analysis. All the subjects were included in pharmaceutical chemistry. And then pharmacology is the area where it includes pharmacology, human anatomy and physiology, and pathophysiology. But the subjects which were included in pharmacology and its subjects. And finally, the major subject is pharmacognosy. And then this all are the major subjects, and then we will move to the minor subjects. Minor subjects were like microbiology, biotechnology, and biochemistry, where you will have less scope, means less weightage, less number of questions will be uh, from this area. And then next, as I was expertise and I was dealing pharmacognosy, so we will see what are the topics and all we have to cover in this pharmacognosy subjects. And we will see the previous year questions, means the scope of questions, how many expected questions will be there, and what are the topics we have to cover, we will see. And then this is the previous year question paper list. So according to the topic here, in the particular year, uh, the questions were came. First, introduction of pharmacognosy is the topic, where in 2024 around two questions were from that topic. And from uh, same topic in 2023, 3 to 4 questions were asked, and in 2022, 3 questions were asked, and in 2021, 8 questions were asked. So from year to year, from topics, the questions asking pattern will be different. So every topic is important to gain more marks. So here are many topics like introduction of pharmacognosy, alkaloids, glycosides, lipids and volatile oils, resins, tannins, carbohydrates, and plant fibers. And then next, coming to the pharmacognosy, and what are the topics, subtopics we have to learn from this pharmacognosy, we will see. So here are main two subjects like pharmacognosy and herbal drug technology. So in herbal drug technology, what and all you have to cover is Indian systems of medicine, herbal formulations and herbal cosmetics, traditional herbal drugs and nutraceuticals are the things mainly you have to focus. And then from pharmacognosy subject, introduction to pharmacognosy, traditional systems of medicine, means in detail we will see in the next slides of this pharmacognosy subject. And then coming to the next slide, so the previous slide is for preparation of GPAT only. So if you are preparing for NIPER exam, so you have to focus more in previous slide and this slide also. So here what and all you have to cover for this NIPER, even with the previous slide. And here you have to focus mainly how we will extract, how we will isolate, and how we will characterize the plant chemical constituents we have to focus. And then various separation techniques used for isolation of natural products. Various separation techniques means like chromatography, all we have to cover there. And then biosynthetic pathways like amino acid pathway, then malonic acid pathway, and then like shikimic acid pathway. These are the pathways where we have to cover. And the next, primary and secondary metabolites. So these are the metabolites which were obtained from plants. Like these secondary metabolites like alkaloids, glycosides, tannins, lignans, saponins, lipids, flavonoids, coumarins, anthocyanidins. So from all these secondary metabolites, so chemistry of these classes is very important to gain marks. So the chemistry means like what is the class, what is the chemical structure present in it, what is the class, what is the family, that and all you have to learn from these primary and secondary metabolites. So next comes therapeutic classes like anti-diabetes, hepatoprotective. So here what are the plants, phytoconstituents or phytopharmaceuticals which were used as anti-diabetic agents, hepatoprotective agents. So all these plant chemical constituents that will be useful for this treatment of the diseases we have to learn. Okay, and then next, dietary antioxidants, marine natural products, plant growth regulators we have to focus. And then biological sources of important classes of natural products. So already I have said biological sources is like from which part, like leaves or roots or stem, flowers or fruits, seeds, which part of the plant is important, means important phytoconstituent which was present in particular part we have to know specifically. And then standardization of natural products. So in detail we will go what to learn. Okay, and according to the for MRB pharmacist exam, the syllabus is like definition, history and scope of pharmacognosy, including the different systems of medicine like Ayurveda, Siddha, Unani, all these things. And the next, classification of drugs, then natural origin, adulteration techniques, means the types of adulterations and and its evaluation. And then next, occurrence, distribution, organoleptic evaluation, chemical constituents, including identification tests. Identification tests are very, very important. And then pharmaceutical applications of categories of drugs. So this is the syllabus for MRP pharmacist. So it is, the syllabus is very minimum. So you can score good marks if we will cover all these topics for the MRB pharmacist exam. And then next we will see what and all we have to cover under the introduction of pharmacognosy in this pharmacognosy subject. So the definition comes like this: pharmacognosy is a systematic study of crude drugs. So these crude drugs which are obtained from natural sources. So the natural sources are like different ways, like plants, minerals, animals, microbes, marine, etc. So the pharmacognosy is the term, it's a Greek term actually, and um, pharmacon, it was divided into two, and the first word pharmacon means the drug, and gignosko means to acquire knowledge. So as we already know, it's a study of crude drugs, right? So we already know that it was obtaining from natural origins from different sources like animals, minerals, marine, microorganism, and biotechnology. So, for example, uh, wool, silk, honey, insulin, these are the examples which were obtained from animal sources, and asbestos, chalk, kaolin, bentonite, or the things which are naturally obtained from mineral sources. So all these were accordingly. And then moving to the next slide, we have to cover history of pharmacognosy. Which scientist isolated which chemical constituent, and in which year, what they have identified, what they have developed different, if they have developed different technologies or techniques like plant tissue culture, something like that. And who all are the scientists are there for the developing of this pharmacognosy, means like these natural sources or not. We have to know about all these scientists and their achievement, what they have done. And then uh, Here we will cover traditional and alternative systems of medicine like Ayurvedic medicine. In this Ayurvedic Indian system of medicine, we should know who is the father of Ayurvedic system of medicine and what is the main principle or objective of this system of medicine, and how it will treat the diseased person we have to know. And then what are the doses forms will be there, we will be going to cover all these things in this Indian system of medicine, that is Ayurveda. And then next, homeopathy. What is homeopathy system of medicine, what is the definition, who developed this system of medicine, what is the main principle, all these things we will cover in these traditional systems of medicine. And then next, coming to the classification of crude drugs. So if something is there, it should be classified, right? It should be made simple, right? So if the crude drugs are having a classification, it will be easy to no, it will be easy to understand, it will be easy to study, right? So there is a need for classification. So the classification is as follows, like alphabetical, taxonomical, morphological, chemical, and then pharmacological and chemotaxonomical. So all these things we will cover in the classification of crude drugs. And next is cultivation and collection, means how we will cultivate the medicinal plant, how we will collect. To cultivate and collect, there are different processes, okay, to acquire, to get good yield of the medicinal phytoconstituents. There are different methods and types. And then processing, drying and storage of drugs. So for these natural products, for these phyto constituents or chemical constituents, for everything there is a um, particular step need to be followed. And then coming to adulteration and types, different types of adulterations are there. It may be done by intentional or it might be done by unintentional. So different types, and what with what they are adultering the natural phytoconstituents, we will be going to cover in this adulteration uh, topic. And then next, coming to biogenetic pathways, as we have already discussed in the previous slide, it was like shikimic acid, mevalonic acid pathway, and then amino acid pathway. So next, coming to plant growth regulators, these are like auxins, zebralin, cytokinins, and abscisic acid and ethylene. So we have to learn here the definition and what is its function. The function is main important, and in plant tissue culture how it will help also we have to learn. So these are the things you have to cover to score good marks, and to crack the GPAT or NIPER or MRP exam, some drug inspector exam. So all these things will be helpful for your preparation. So in the next video, we will be starting with our introduction video to the pharmacognosy, and then we will start our syllabus. So thank you. Please like, share, subscribe our Think Pharma YouTube channel and follow for more updates.